You are welcome to Optimum Health Solutions. I'm your host, OJ Odia. Now, we have another topic to discuss today. This time, we're talking about diabetic foot and hand ulcers. We'll be paying more attention to diabetic foot ulcers, or diabetic foot for short. With us today is our special guest, a professor of diabetes, Professor Chioma Unachukwu. Professor Unachukwu, you are welcome.
Thank you very much, sir.
We are going to talk about diabetic hand and foot, but we'll concentrate on diabetic foot. Why do we talk about diabetic hand and foot? What is it that is special about them?
Thank you, sir. Diabetes foot and hand, they are very serious complication of diabetes. They are very, very common, very, very dehumanizing, and very life-threatening. In fact, they are when combined to other complications of diabetes together, diabetes foot contributes to more than all the others put together. So it is a very common complication, very life-threatening, and it causes a lot of pressure on the patient, on the community, and on the hospital. So it is a complication of diabetes that we always like to avoid if it is possible.
Okay, very good. Now, prevention is usually better than cure.
Yes, sir.
So it is better to prevent having a diabetic foot or a diabetic hand for that matter. So what do we do to prevent this special complication of diabetes? What do we do to
Yeah, thank you,
prevent?
sir. Um, like we all know, prevention is better than cure. So to prevent diabetes foot, first of all, the major thing would be to even prevent diabetes if it's possible. So because if you don't have diabetes, there won't be diabetes foot or hand issues. Yeah. But where the diabetes is already there, the major thing will now to make sure that the patients do not get the complication of the foot and hand. And to avoid the complication, the major things that should be considered would be one, good control of diabetes. Because if diabetes is well controlled, there won't be, the extent of the complications occurring will be less. So good control of blood sugar is very important. Also, the patients need to be aware, they need to be educated on diabetes care and more especially on foot care. Because if the foot is well taken care of, they will be able to prevent the sores coming. And to prevent the wound coming, one, because the diabetes causes damage to the nerves. The damage to the nerves and also damage to the blood vessels of the lower of the leg and the hands, So when the nerves are damaged, the patient will lose sensation and will not be able to feel pain or even to feel objects. The foot will become numb, as if that part of the body doesn't belong to the patient. And these patients may go on to match on minor pins, minor needles, and they easily get wounded without knowing. And because the blood vessels on the foot are also not functioning well due to diabetes and some other factors, the wound will not heal early. It will take a very long time to heal. And also, because the wounds take a long time to heal, they may progress to cause death of the area. Because even in diabetes, there is a very, the patients are very predisposed to infection because diabetes reduces immunity. So these wounds can get infected. When there is infection and then the blood vessels and blood supply to the area is already compromised, is reduced, the area can be dead. And these areas can actually now get dead, and the only way to go will be to remove the dead areas. So prevention is better than cure. So it's better to make sure that the patients present early also in the hospital, because when they present early in the hospital, the needful will be done. But unfortunately, most of the patients, by the time they come, the wounds are very, very, very severe, because they do self-medication at home. They will go to prayer houses, go to alternative medical care, and before they come, the wounds are very, very bad.
Okay. So when they present in hospital, usually, let's assume they present with just a sore
Yes.
uh, in one foot, for example. So what can we do to prevent it from becoming worse?
Yeah, thank you, sir. Yeah, when they present to the hospital, the major things to do would be to make sure that things don't get worse. So if they present very early, which we usually advise them to do, we encourage them to come to hospital early, no matter how small the wound is, because no wound is small in a patient living with diabetes. Any small wound means a lot and could cause a loss of that leg or the hand. So if they come early, there is need to control the blood sugar very, very well. And then because, these areas, the wounds most of the time comes from, areas of high pressure on the foot. So one of the major things we do will be to rest the area, because when the area is rested, then the wound will heal faster.
So there's no pressure on the
Yes,
leg.
there'll be no pressure on the leg. So, and this we can achieve by using, there are some special shoes, that can be used. And then patients can be encouraged to use crutches to put off pressure, from the affected leg. And then bed rest, which we usually do in the hospital. We ask them to be in bed for at the most times of the day. Yeah, so that there will be reduction of pressure
Pressure on
on
the
the
leg.
area.
Okay.
Also in the hospital, a major thing, because these wounds, most of the time, they are very bad, they are very offensive, and they are infected. So we use a lot of antibiotics, very strong antibiotics that will cover a lot of the germs that will cause this infection. So when they come early, these germs can easily be taken care of, and the wound healing will also be taken
So the
care
wound
of.
can also be dressed.
Yes, it can also be, yes, dressing of the wound is very important. Special, there are special materials that can help the wounds, to heal early when you dress them. Will involve then the dead tissues, because the wounds are usually, the areas, and a lot of dead tissues around the wounds. There'll be need to make sure that the dead tissues are removed, to expose the live tissues so that they could
Can heal.
heal easily. Yes. So removal of the dead tissue is very, very important. And if the wound is so bad and then the area is dead, which we usually see most times in the hospitals, because most of the patients come very late, then the only option would be to remove that dead part. It could be dead toe, it could be, in fact, the whole leg could be, the foot could
Can be
just be
removed.
dead. And you now do what we call amputation, which means just the removal of that terminal area of the leg or the hand that is dead.
So the whole idea is that we shouldn't get to that level of removing a foot, for example.
Yes,
Okay.
yes, that's why we encourage them
To
to
come
present very
early,
early
early.
to hospital, and to make sure they also take care of their foot.
So if a foot is removed, how will the patient walk again?
So the patient can walk. There are many devices these days, that can help the patients to walk. There are prostheses. There are also,
Artificial limbs.
yes, the artificial limbs, we call them prostheses, that can be fitted, and nobody will even notice that it's an artificial limb. They will match the color, the size of the leg, and everything. And the patient will be encouraged to walk. The only problem is that it's very expensive. So that's why we encourage our patients to please do the needful, so that these wounds don't develop in the first place, don't get infected and don't get so bad that will lead that it will progress to dead limb that will now, cause amputate, cause them to be removed. So it's better prevented because it's also a very difficult situation. Most patients do not accept amputation because it is very dehumanizing. Some people will make sure that, that they will, in our culture, it is believed that if one dies with a lost part, lost limb, when the person comes to the next world,
will still have it will be crippled or something.
yes, the person will not have a limb.
Okay.
So most people don't even accept amputation, and they will prefer to die with the dead limb, yeah, and be buried with the
The
body whole,
complete, yes.
yes,
But
than
even
a
though they
part.
have
Exactly,
some
exactly,
parts that are
yeah,
not
yes,
are not okay.
yes.
So thank you very much,
Thank
Prof.
you, sir.
I think we have really discussed it extensively, diabetic foot, and starting with diabetic foot ulcer, to how to prevent it, then how to manage it if one should come early to hospital and get the hospital staff to manage it as thoroughly, as effectively as possible. Is there any other advice you want to give to diabetics?
Yes, sir. Thank you. Yeah, the major thing, is education on foot care. We encourage diabetics to take care of their foot because if the foot is well taken care of, there may be the wounds will not develop, and then there will be no need for amputation. So prevention of the wound developing. So education is paramount. So the first thing we actually ask them is to make sure they take their medications well as prescribed, and then control their blood sugar, and then to take care of the foot, to make sure that the foot, because the foot, there may be loss of sensation on the foot, they must not walk,
Barefoot to
barefoot.
the,
Yes,
yes.
they should not. It's not advisable at all, whether at home or outside.
That.
And the shoes, they should wear proper shoes,
Not tight fitting
not
shoe.
tight fitting, and then the shoes, they should always inspect the shoes, put their hands on the
Make sure
inside the
that there
shoes
are
to make
no
sure,
foreign
yes, no foreign
objects
body,
in the
because
shoe.
if there's a foreign object, a pin, a small stone, because they've lost sensation on the foot, that one may cause small problem, may cause an injury, which they may not notice.
Yes.
Because they also don't see very well.
Very well.
They would not be
So they
able.
shouldn't be cutting their nails, for
Yes,
example.
yes, cutting nails, very important. They should make sure that they don't cut towards the edges. They should cut horizontally, so that they don't go deep to the
And then
edges
cut
of the,
their
exactly.
feet.
And then they should not use razor blade. They should use clipper or nail cutters. And then where they have impaired vision, they should get, a family member to help them assist. And then when there is foot deformity, especially, due to, that nerve damage, then the pressures on the foot will be altered. Some areas will now develop abnormalities like, hardness. Some areas of the foot will become hard because they're bearing too much pressure. So this kind of things should not develop when they wear appropriate shoes. Yes. So appropriate shoes is very important. So, and then when because they lose sensations on the foot, sometimes they feel numb, as if the foot, it's not, yes, they don't feel anything. And they may expose this foot to heat. They may apply all sorts of heats, and because heat,
because they want to feel something.
Exactly. They want to feel, and they will not know that the temperature of that water or whatever they are putting is high. Before they know it, they get burns. And this will now progress to, and then they will make sure that they wear, that the shoes they are wearing is not, crowded on the toes, the toe space, the front part where the toe should be wide. It should be either a square or round, not pointed, so that they don't squeeze the toes to now cause compression, and that will cause injury and then progress to very bad wound. And also when they buy shoes, they should buy the shoes towards the evenings, when they, because it's
Okay.
yes, towards the evenings, when we assume that towards the evenings, the legs got a little swollen, the
Swollen,
foot, yes.
okay.
So when you buy shoes at that time, you're more likely to
So
get the
fit,
appropriate
appropriate
fit.
fitting
Yes,
shoes.
appropriate fit. And then even when they buy the shoes, new shoes, they should do what we not wear the shoes for a long time at the beginning. They can just wear the shoes for 1 hour, 2 hours in a day, in the second day, third day, and then make sure that there's no problem. Before they
Start
can now
wearing
wear the
regularly.
shoes regularly. Yeah, and then the shoes also, the sole of the shoes should be hard, so that foreign body,
Not pierce it.
yes, nails. We've had patients that the shoes got pierced, through the sole. The patient, because the patient couldn't feel the,
Anything, and then
yes,
went
yeah,
into the
exactly.
foot.
So it was when they were now looking at the shoes that they noticed blood, started looking at it, and it now happened that the
And
nail
the nail
has
had
pierced
pierced it.
through the sole. So we encourage them to wear, shoes with thick
So,
soles. And then the shoes also should be covered. We don't like them to expose their foot. It's, something like a canvas, with good quality leather. Shoes should be of good quality to allow, air to come
to
in,
come in
to
and then
absorb moisture, and so that there will be no infection. They are also advised to clean, wash the shoe, wash the foot very regularly. And when they wash the shoe, not with very hot water, with just normal temperature water, and then they should clean in between the toes to
services
avoid moisture, in those
and
areas, and then
infections.
infection. And then we also encourage them to moisturize, use moisturizing lotions on the foot, so that the areas don't get cracked. Because when the foot is dry, it can easily get cracked, and small cracks can now lead to very big ulcers if nothing is done to it. So care of the foot is very, very important, very, very important to prevention. Yeah, so it's very important because once an ulcer has occurred, it causes further ulcers, reoccurrence. And it's like, and also if amputation has been done on a patient,
We can have
that will
another one.
also predispose to another ulcer and another amputation. So foot care is very, very
It's
important.
vital.
Yes. So
Thank you very much.
Thank you very much,
Thank
sir.
you very much for coming, Professor Chioma Unachukwu. Viewers, we have been talking to Professor Chioma Unachukwu. I'm sure you have enjoyed her presentation today, and we hope that she will come some other time. Maybe we'll talk about another very interesting topic. But for now, thank you very much, viewers. Please remember to subscribe. Subscription is free. Subscribe and then like and share. Thank you. Bye for now.